Welcome to Reaching the Hearts to Reach, leveraging social media for participant engagement and retention. Again, my name is Zami Tinashe Hemingway, and I'm the Capacity Building Assistance Gender Affirming Project Manager with Denver Prevention Training Center, where I, along with an amazing team of identity consultants, provide technical assistance and capacity building trainings on status neutral gender affirming care to directly funded community-based organizations, health departments, and clinics in 15 jurisdictions of the West region. I reside on Toto'odon O'odham territory, also known as Tucson, Arizona. And I'm very excited to be here today. So for the sake of time, I'm going to jump right into it so that we have plenty of time to do Q&A. To help you all have a clear picture, I'll provide the what, the why, and the results. So the what is a 5-agency grant-funded collaboration. Through this collaboration, we provided mental health services, sexual health education, and HIV testing, housing, food, and bus passes out of a central location, which was an LGBTQ drop-in center for youth ages 13 to 23. The collaboration focused on reducing substance abuse amongst queer and transgender youth of color, particularly Black and Indigenous youth of color, by connecting them to services and increasing HIV testing. We were more than a year into our 5-year grant, and we were not meeting our numbers around testing, therapy, or really any of the services. And this was for 3 main reasons. The first reason was the collaborating agencies had a reputation for being homophobic, transphobic, and unwelcoming to anyone who was not a white cisgender gay male. Secondly, the programming at the time was not resonating with the clients because much of it was replicated from previous years and what former youth liked, but not what the current youth were engaging in and liked. And thirdly, prior to the hiring of the staff for this grant, there were no staff that the participants felt they could connect to or really see themselves in. Because of this, youth were not engaging in the free therapy, housing, HIV testing, nor sexual health services that were offered. It didn't matter what strategies we used to get youth in, including offering incentives for using the services provided under the grant. Youth would come in when they needed food or a bus pass, and that was about it. So we had to develop a plan to figure out how to engage the youth more, which leads me to the strategy. And the team strategy was to host Jersey Shore Nights, utilizing Facebook as a social media platform to promote our event, and using the drop-in center as the hub for the event to build community and rapport so we could actively engage youth into the services we were offering. So the why Jersey Shore? Jersey Shore was extremely popular at the time. It had been on MTV for a few years at this point, and it was all the youth spoke about. They always begged for us to watch it in the center, but because of the show's emphasis on drinking, partying, violence, sex while under the influence, we were very much against them watching it in our space. We also noticed that youth in our workshops and groups at the high schools that we worked at were also always talking about Jersey Shore. So no matter where we went, our population was obsessed with this show, the language, the people, everything about it. One day, we were at a high school doing a workshop series on intimate partner violence, or IPV, and domestic violence, so DV, amongst youth, and the youth were not interested. They were not engaged at all. It was like pulling teeth to get them to engage with us and focus on the presentation. So in the middle of the workshop, we decided to pivot and change our plans and decided to talk about a relationship on Jersey Shore between Sam and Ronnie. A couple that yelled, screamed, threatened, and threw things at each other and engaged in gaslighting, essentially the poster couple for emotional abuse at the time. We asked the youth what they felt about the relationship between Sam and Ronnie, and the group lit up. We had one of the best groups and cohorts around IPV and domestic violence amongst youth and LGBTQ youth at the time. From there, we decided to host Jersey Shore Nights. Essentially, we used content marketing to find out what youth wanted and began designing programming around it. We met as a team and said, this is what our participants want. So how can we do this in a way where it's beneficial to the participants and our funders' needs, as well as reach as many youth as possible and get them in so we meet our numbers? This is where Facebook and statewide networking came in. Facebook was gaining more and more popularity amongst LGBTQ youth of color around this time of 2010, 2011. Prior to this year, more QT BIPOC youth were on MySpace and mostly used that for hooking up. But what we saw was that more and more youth were going to Facebook because it was a social status and provided some form of social capital for the youth. We also saw that more youth who were in high schools, community colleges, and universities were also on Facebook, and they used that for GSA networking. The Drop-In Center also ran the statewide GSA network at the time, and we were trying to find ways to reach more rural youth to provide HIV and STI testing and services. So we used our program's Facebook page to promote Jersey Shore Nights, added our event calendars to the Facebook page, and staff created work Facebook accounts for participants to add and communicate with us directly. We're also in Arizona, which is a very conservative state. So we use Facebook to give school counselors and GSAs information about testing and our other services to their students. This reduced the risk of the staff member potentially getting in trouble for passing out items that were not allowed on campus. For example, flyers with the word sex chat on it or condoms, etc. The school counselors and GSA sponsors started to direct the youth directly to our Facebook page to communicate with us about our services and programming directly. We had Jersey Shore Nights on our sexual health and our sex chat nights, but intentionally curated the night to be an all agency weekly event that provided assessments, program enrollment, HIV testing, food, therapy sessions, etc. We also designed the Jersey Shore Nights to be centered around addressing DV, IPV, and facilitated conversations after each episode around testing, communication, relationship dynamics, and consent when you've been partying and drinking. During Jersey Shore Nights, participants were able to sign up for testing, pick up condoms, and utilize majority of the services that the agencies were offering at the time. So what were the results of this strategy? The first result is that it increased youth participation. By utilizing social media to promote our calendar, resources, and Jersey Shore Nights, we saw a huge increase in youth participation and engagement in all services across the board. Youth were more willing to communicate with staff on social media and schedule appointments for HIV testing, mental health services, housing assessments, than they were just coming in and talking to us directly. The other result was an increase in HIV testing. So as a result of the increased participation, we saw that there were more HIV testing among all participants. This partially happened because we did have more youth, and it partially happened because of the rapport that staff were able to build with the youth once we got them into the program. Staff modeled and held intentional conversations with youth about testing. For example, when staff did not see youth getting tested or very little youth signed up, part of the staff strategy was for them and volunteers to get tested themselves. When the youth saw staff getting up and getting tested openly, more youth felt comfortable testing in the space. They also asked questions about why one would get tested, the tests we offered, and what happens if you came back negative or if you came back reactive or positive. This strategy also led to an unofficial referral process with the county health department. Since we only provided HIV testing as part of our program and the youth were interested in full panel testing, the health department would come to the drop-in space a few times a month to offer full panel testing. Youth who only wanted HIV tests would go directly through our sexual health educator, and youth who wanted all STI testing went through the health department instead. This also led to us being able to refer youth to the health department for treatment and other services because we were able to say things like, hey, you remember Michael Doe who comes in and tests during Jersey Shore Nights? Well, he works at the health department on Wednesdays and can help you get access to X, Y, and Z. Let's call him and tell him you're on your way and he'll meet you at the door. Also, when youth got tested and they did not have a phone number, they would sometimes list the drop-in center's number or the number of a staff person as their number for testing. And they would ask the staff to message them on Facebook if someone from the health department called. This helped us facilitate treatment between youth and the health department if they received a reactive test. We also had several youth participants at the time who engaged in sex work for housing and to meet their basic needs, and they didn't want to go to the health department because there was a fee for them to get tested. We were able to work with the health department to waive fees for our participants, which increased STI testing for them as well. The next result I want to highlight is increased uses of mental health services. As mentioned earlier, after we watched an episode of Jersey Shore, we facilitated conversations about healthy relationships, DV and IPV, communication, etc. And so these conversations were co-facilitated by our therapist and our sexual health educator, and sometimes an advocate from the anti-violence program. As a result of these conversations, youth felt more comfortable following up with the therapist about their experience and concerns. Also, this led to us discovering that a lot of our youth were in unhealthy relationships, had suicidal ideation, were in IPV or DV situations, and some were in situations that led to mandated reporting. Some of these findings came through because they reached out to us directly on social media and then followed up with us in the drop-in space where we were able to support them directly. And additional things came out of the therapy sessions that they would do with our therapists on site. The other piece is a lot of youth came up to staff and they also shared concerns about their peers, which created an environment of peer support and really communal wellness and community compassion. We also saw that by having all collaborating agencies present on the same night offering services, it really helped streamline the work because participants knew that they had to show up a certain day and time to get services instead of trying to make multiple appointments or going to multiple locations. Additionally, we saw that through promoting on Facebook and having that be a way to refer participants to us, we saw that our reach went beyond just local youth. We started getting youth from Mexico because Tucson is is considered a border city. So we also got more youth coming from Mexico to visit the drop-in center for sexual health information and services, as well as youth coming from more rural areas where they did not have access to an LGBTQ youth program and they wanted specific sexual health information about LGBTQ sexual health. And then lastly, holistic health and wellness programming was able to happen. So having conversations about sexual health through Jersey Shore and utilizing social media made room for us to address issues in a more holistic way. We know that amongst the LGBTQ community, there are high incidences of psychological distress. And we know that when people are under high stress or their mental health is not well, it leads to engaging in behavior that can be considered riskier, leaving people more vulnerable to DV and IPV situations. Creating a space that normalized discussions about sexual health, abuse, and pleasure also allowed us to talk about partner negotiation with participants, which led to clients disclosing that they felt uncomfortable asking for their partner to put on a condom due to fear of violence. This information allowed us to connect more youth to housing because we were able to refer them to DV organizations who had housing for survivors. And we know that housing is a huge piece of HIV prevention, care, and ending the HIV epidemic. So with that, I'm going to pause and ask, what questions do you all have?
Yeah, so feel free to place your questions in the chat, or if you want to come off of mute, you can raise your hand and share verbally that way. At the current moment, we have some love from Michael Weiss saying, brilliant project. We have another comment that says, that's amazing. And I see we have a couple hands raised, so let's hear from Alicia.
Hi, thank you so much for that. That was incredibly helpful and just really inspiring. I am curious for those youth that did not have a phone number or didn't want to give one and used like the health department for a Facebook notification. Did you give them their results through Facebook, or did you meet up with them again? And if I missed that, I apologize. Thank you.
Thank you for your question. Great question. So what would happen so the health department knew, because we work specifically with 2 people at the health department to provide services for our youth, we intentionally built that relationship. And so whenever a client, they knew what our phone numbers were directly, so they automatically knew that, oh, this is the drop-in center's phone number. And so when they would call, they would typically just call me directly, because at the time I was the manager of the youth program, and they would say, hey, Zami, we have so-and-so, they put your number down. Can you arrange for a time for us to meet with them? And so I would then message the youth and say, hey, I want to follow up with you with the health department. Are you planning on coming in today? And the youth would let me know their schedule. And then the health department, myself and the youth would develop how to get the results. So either they would bring it to the drop-in space if it was during the week that they were coming, or we would give the youth a bus pass and then we would meet the youth at the health department because we weren't transporting youth in our cars. So we would just meet them there, and that's how they would get their results.
Thank you so much.
And Michael, I see your hand raised. Feel free to unmute.
Thank you. This presentation was amazing. Thank you. I'm curious if you had any feedback or if you did any outreach on other social media apps, because locally, when we've interviewed our youth, they're telling us that Facebook is for old people.
Yeah, no, it's true. Yeah, youth absolutely say Facebook is for old people. So this was done back in 2010, 2011. If I were to do this project now and depending on what demographic I was working with. So for example, we were focusing on Black, Indigenous, and youth of color. If you look at the social media trends now, majority of Black and Indigenous youth of color are on TikTok. And so we would most likely have a TikTok account. We would do some reels, do different strategies there, and probably also connected to Instagram and still continue Facebook for our older youth. So we serve folks 13 to 23. And so for youth who were more closer to the 23 age range, we would continue to do Facebook. The other piece is, yes, a lot of youth are saying Facebook's for old folks. And when you think about more rural areas, frontier areas, or youth who may not have phones that have a lot of data, they're still going to utilize Facebook. And so we also have to look at SES, or socioeconomic status of the youth or of the demographic, and what's accessible to them that way. Because some of these platforms you can't use on the computer, you can only use on your phone, or the majority of what you can do is only on your phone. So if I did this today, I'd be utilizing TikTok, Instagram, and still have Facebook as a backup.
In the chat, we have a lot of love for you. Amazing project. Great job. There was a question about asking what year was it done in, but you just addressed that a moment ago. Another comment says, love how you're able to meet the youth where they were at and also making it a safe space for them to talk. Seriously, amazing job. Amazing presentation, excellent collaboration and use of both social media and current community interests. And then a comment says, Facebook is for old people. What? And that's all we have so far. So folks, if you still have questions you want to ask Zami, please feel free to put them either in the chat, or you can raise your hand and I'll call on you to ask verbally. I see you, Anita. Go ahead.
Okay, thank you. Hi, Zami. I really enjoyed your presentation. So as it pertains to like communication and, you know, young adults not having access to a phone, I know for Instagram and Facebook, if they have the necessary capability on their mobile device, you can make audio calls or video calls through both. But either party has to have access to it. So from the organization standpoint or the health agency standpoint, has there ever been any talk of like creating a social media page, and then that way you're able to stay in constant contact with your clients that way? Because even if they don't have a phone, they can either do an audio or video call.
Yes, so that's a great question and great point. So one of the things we did do, because we wanted to make sure that youth did not have access to us when we were not working. And whenever I'm in a position of leadership, I always stress taking care of yourself. And when you're not at work, you're not working. And so as a manager, one of the things that we did was we all created work profiles. And so thinking about, again, if we were to do this today, we would have an Instagram profile or a TikTok profile that's just for the organization. And then you can also put notes in there that say when people are active. So for example, if I were going to do a TikTok page, I would make sure that they had information of how to access the drop-in center, the phone numbers, emails, etc. Say when a staff is available online, and then when a staff isn't. And if it's an emergency, because the only reason a participant should be contacting me outside of business hours is if there's an emergency. The emergency line would be our anti-violence project's line. And so they would call the AVP line and they would be able to work with them that way. And that would be the only 24-hour. But I do recommend that if you are going to do a social media campaign, the organization should have its own page. And if staff want to speak directly to the clients or participants, then staff should be doing that through a work page and not through their personal pages.
So far in the chat, we have a comment about the use of Discord. A lot of youth are using Discord as well, if folks are interested. And then there was a question about going over the part about creating work Facebook accounts. I know you just mentioned that. I just want to ask the person who made posed this question if there was something more specifically you wanted to ask Zami about creating work Facebook accounts, or has Zami already addressed that with his previous statement? Okay, I'm good now. Okay, cool, thanks. Any other questions? Oh,
well, I do just want to address Discord. Discord is really great because it's free. The only thing about Discord, because yes, a lot of youth are using Discord, is similar to like a Reddit, but older folks tend to use Reddit and younger folks are doing Discord. A lot of LGBTQ folks or QT BIPOC folks are using Discord also for building community and learning platforms, so free learning platforms. So Discord is great. There are at times difficulty in accessing their server though. So Discord isn't the most, in my opinion, isn't the most effective always, because the links expire. If too many folks are trying to access the server, it could disrupt it or crash. And if the only time that it's a little more stable is if you pay for the different services. And so Discord, yes, is good. That would not be the first thing I would go to though, because it does typically crash, and some folks, it's hard to navigate for some folks. And it also doesn't have as many visuals unless you pay for those.
Just want to note that folks are talking about why we're picking on old folks. I just want to make a quick comment myself. I'm not on social media anymore, but when I was on it, I have Facebook and Reddit. So y'all know my age now. I see another question. So while outreaching to youth, did you ever run into parents who did not want their children learning the material? And if so, how did you handle the situation?
That's a great question. So we did, so there's just to give a little history, the youth program at the time was very focused on harm reduction and meeting youth where they were at. So we had rules around you cannot use substances in the space, for example. But if a youth showed up and they were under the influence, as long as they were able to engage and not be belligerent, etc., then they were able to be in the space, even though we were technically a sober space. We had a lot of parents who didn't like that rule. We had a lot of parents who didn't like the fact that our sexual health education, that anyone within the age range, so from 13 to 23, were able to come to our sexual health programming. And some parents wanted us to separate it to where folks under the age of 18 got certain education and then folks over the age of 18 did. And we did not do that. And we just stayed firm in the fact that youth are going to have access to this, and we rather them have access in a space that has their best interests at heart, where we can have dialogue and where there are folks who are therapists, social workers, advocates, etc. there. And we just had conversations with the parents. That's also why we end up shifting our perspective on Jersey Shore, because we did not want youth watching Jersey Shore. And we're like, we have folks under the age of 18. There's a lot of sex under the influence there. And so, people can't consent, etc. And we said, well, we know that our participants are watching this. We know that they are engaging in this behavior as well because of the one-on-one conversations that we have with them. So instead of pretending as though this is not the reality for some of our participants, why don't we make this a learning opportunity? And that's what we talk to parents about who had a hard time with it. This is a learning opportunity. We know that these are several youth experience. And so what we want to do is provide an avenue for us to normalize talking about these experiences and also normalize saying no, understand that consent is a real thing. And if you cannot consent, if you are falling asleep, etc., then that is not consensual sex. That's not sex. And also give people a place, give youth a place where they can talk about, wow, I didn't know what a healthy relationship was. And I didn't realize that I was in an unhealthy relationship until we start talking about what we were watching on Jersey Shore, until we start talking about, everybody in the room thinks that it's not acceptable that Ronnie just punched the hole in the wall because he was angry at Sam. My boyfriend does that every time we have an argument. Those are the conversations that we end up having in the drop-in space with the youth, and youth were able to begin to get out of these situations. And like I said in the presentation, it also allowed us to build relationships with DV organizations and get our youth into housing, because youth was very scarce. And so them being able to talk about their experiences, it then opened up more resources for them.
Yeah. Oh my God.
So far, there's no other questions, but I do see folks are using the action plan and taking tons of notes from what you're sharing, Zami. So thank you so much for all this great information. I do want to ask you a question. If you can elaborate a little bit more on the content marketing aspect and how that process shifted the social media content and the response from the youth to your content on Facebook.
Yeah, so, at the beginning, I said one of the reasons why youth weren't engaging was because they were just replicating, I say they because I no longer work with the agency, but they were just replicating the same programming year to year, the same groups, etc. And youth were like, we've done this curriculum 10 times. This is the same movie. This is the same discussion. Like they just were not interested. And when we would do street outreach, all the youth ever talked about was Jersey Shore. Folks who have seen me in person know that I am a body builder or a power lifter. And, folks would engage with me and with other youth by saying, oh, do you juice, or you're yoked, which is all this language that came from Jersey Shore. And I was like, what is happening? I had no idea what they were talking about. And for us, we're like, well, we can't really engage with our youth or develop programming when we have no clue what they're talking about. We have no clue what they're watching. And we're just replicating the same old thing. And so we just start talking to youth about what do y'all enjoy? But we had suggestion boxes for them to say, like, this is the type of programming we want. And we started watching the things that they watched, and we really essentially had intergenerational dialogue, because we would talk about how this is just some young people stuff, this is not stuff that we would do, or this doesn't make sense to us. And we would have this intergenerational dialogue around the differences, why something's funny, why something isn't, what's problematic, what's not problematic, what's the language people are using. And then we start developing programming around it. And so that's a little bit of how we did our content marketing, was listening to youth, watching them, seeing what was popular, really consuming it ourselves so that we can have actual conversations with them and not fake the funk, essentially.
There's and thank you so much, Zami, for that information. And there's another question in the chat. Did you receive pushback from leadership about showing Jersey Shore? I love this idea, but the comparable show I can think of in our area is Euphoria, and I don't know how I would sell showing that to our leadership.
Yes, that's a great, if I were still working directly with youth, Euphoria would be one of the shows that I would want to use as well, just to be completely honest, because it is so relevant and close to the experiences of a lot of the youth who I used to at least work with. So if I was doing this today, I would use Euphoria. So I was lucky, I would say that. I was very lucky because my supervisor, who was the director of programs at the time, was a former youth participant, and she was a former program manager of the youth program, and she knew the importance of doing the work in that way. Meaning when we told her we were gonna do Jersey Shore, she said, okay, how are we gonna tie this back into funding? How are we gonna explain it to the funders? And so that's where the strategy around having conversations at the end of every episode came into play, where we were able to talk to our funders about how the way that we're meeting the therapy numbers, testing numbers, etc., is through this. By tying it in, by collaborating with the anti-violence program, also gave us a little more leeway with leadership, particularly when the ED found out about it, and they were not very happy, but we were able to say doing this programming actually helps us meet numbers across the organization. And that we have a licensed mental health professional there, we have advocates on hand, we have this whole process. The only thing that I would add if I were doing this today, it would be some additional liability. So I would have anyone who is under the age of 18, if I were going to show Euphoria, I would probably want an additional consent form filled out. And so the way that we handled consent forms is we said, if you are under 18, here is the form, you have to bring it back signed. That was the instructions. So as long as we had a signed consent form, I would use Euphoria today. But I was really lucky because I did have a director who used to be a part of the program and knew exactly firsthand what our youth experienced because she experienced it.